position and our view on the legislation, on the law, and our views on some of the changes that we think should be made. For those of you who don't know me, my name is Greg Moore. I am the State Director for Americans for Prosperity. And so first of all, I want to welcome you all for coming. Thank you for coming out. The Americans for Prosperity obviously was someone who vocally opposed the idea of Obamacare when it first came before the Congress. And we spoke about some of the problems, and now we're seeing a lot of those problems starting to show up and become a huge issue. And at this point, we can say the biggest issue we can identify is the fact of how many broken promises have been made as a part of Obamacare. Now, you look at what we were told back when this bill was moving through Congress in 2009 and 2010, and what's actually coming out of the law now, and we see that there's obviously a huge difference between the two. Now, first and foremost, for those of you who are following the law, you probably heard the term, if you want to keep your doctor, you can keep your doctor. Now we know that that's not true, and that many people will lose a chance to keep their doctor, and will lose the opportunity to stay with the same healthcare providers that they may have known for years and years. So that's obviously one of the first broken promises. But trust me, it's far from the last. I think one of the issues which we're told it was that this so-called, I think it's a fairly ironic name, the Patient Protection and Affordable Care Act, because it neither protects patients nor does it make care more affordable. Right. So it's fairly amusing. But we were told by the president that this legislation, if passed, would reduce premiums by $2,500 for a family. $2,500, remember that? $2,500 a family? Well, let's see where we are now. The Ohio Department of Insurance said that it would increase rates by 88% for individual and small group policies. And the Indiana Department of Insurance said 72%. So that's a huge jump. Now, a state like Maryland is obviously very much has a regulated marketplace, and you'd think that the changes wouldn't be that substantial. Even Maryland's insurance department announced that they're going to see rates that increase by 25%. So even in states that have a heavy amount of regulation, we're seeing huge increases in terms of the growth of the cost of healthcare. So the whole Affordable Care Act concept has fallen apart just on its face. And instead we're seeing an Unaffordable Care Act that's taken place and is undermining the quality of our health care across the country. We're also told that there's going to be a cap on out-of-pocket costs. Just last week we learned from the administration that cap, and that's actually an admission to the fact that would raise premiums to such an unsustainable level that we could simply no longer expect that the premiums would be bought, and that more and more of the people who were expected to start buying health insurance would simply say, hey, look, this is just too expensive for me to even to consider. We were told there are going to be no tax increases on the middle class. No tax increases on the middle class as part of this legislation. The president said that on numerous occasions, and we found out that there are numerous tax increases. They're between 18 and 24, depending on how you want to define the term tax. The most notable of which is the one that affects individuals, and that if you do not purchase a qualifying health insurance plan, you're going to receive a tax of $95 per person. And for families, it could be up to $270 per person, or greater as a percentage of your income. So we're starting to see that they're going to see more taxes on the middle class, and working families are going to start having to pay the bills, or being forced to buy an incredibly expensive policy. So those are our choices under Obamacare. Now, we were also told that this legislation would actually reduce a deficit. The president said that Obamacare would reduce a deficit. This past February, a General Accounting Office study said it would increase the long-term debt by $6.2 trillion. $6.2 trillion. We were also told that Obamacare would not ration care. It was absolutely no. I mean, for those of you who remember, Governor Palin said, she used the term death panel, and the administration came and said, absolutely no way, shape, or form would this law ration care. Well, no greater authority than Governor Howard Dean, former DNC chairman, Howard Dean. You might remember him from the I Have a Scream speech. But Howard Dean wrote an op-ed in the Wall Street Journal talking about how the $714 billion in reductions would amount to rationing care. So that's obviously one more example of a broken promise. So we start to see broken promise after broken promise after broken promise. And that's just something that in today's government is turning more and more people away from the trust and faith in government. And not to say that there was a lot to begin with, but this certainly doesn't help. And so AFP was the first person to say, even prior to the beginning of this, and even prior to 2008, when there was a large debate over the reforming of the healthcare system, AFP was going out saying, look, our healthcare system is not perfect. It needs to be fixed. And we were offering substantive solutions for fixing healthcare in 2008. And we continue to support those. And so when those folks out there say there's no one offering any new ideas other than Obamacare, there have been people like AFP who've been here all along saying there are different ways to do this and do it better, ways that actually improve the quality of care. And what exactly is the healthcare system that Americans for Prosperity has been advocating for so long now? We think there should be a patient-centered care. We should think it should be focused on quality of the care. We think that we should be removing barriers between governments and doctors that this Obamacare law puts in place. It adds more barriers, putting the government between your doctor and you. And we also believe we should have efficient and effective health care. And the way you do that is by making health care affordable, not by making health care unaffordable. And so Americans for Prosperity has been out speaking about this issue for many years now, and making a very vocal case for a change in the system. And we've been, I believe, an effective leader across the country in doing that. Now, that doesn't mean that we don't support repealing this law. We do support repealing this law. We believe it should be repealed and the system should be fixed the right way, not the wrong way. The type of law that we've seen has absolutely undermined our healthcare system, and it's eroding trust in government. It's eroding the quality of care. We're hearing about doctors leaving and retiring from the system, and we need to start heading in a different direction. And I think we've seen the tremendous unpopularity of this law really starting to affect the direction of how citizens like you are getting engaged in talking about the issues. The fact that we have all of you coming out on a beautiful summer night in Laconia, I got to tell you, it speaks a lot to what exactly people are thinking right now in the environment of wanting to change in healthcare and doing it the right way. So with that, I have a few folks who'd like to say a few words.
Croctail.